A very warm welcome to each of you joining us today. My name is Emily Grunwald, and I am the CEO of Children's Healthcare Canada and the Executive Director of the Pediatric Chairs of Canada. As we begin today, I would like to acknowledge that I'm joining today from the unceded territory of the Algonquin Anishinaabe in rural Ottawa. I invite each of you to reflect on the territories on which you live, work, and play. Thank you for joining us today on National Youth in Care Day and the eve of International Day of the Family, around our shared purpose to secure healthy, happy futures for children, youth, and families across Canada. Today, we'll have a dialogue about what it takes to achieve this common goal. We'll start by sharing the vision and priorities for action that emerged from an engagement process reaching more than 1,500 stakeholders over the past 8 months. But that's not where we'll stop. Through a discussion with participants moderated by Catherine Clark, we will hear why these priorities matter and how we will make progress by moving forward together. We invite you to join this conversation. Before we get started, I'd like to run through a couple housekeeping items. We hope that you'll consider using the chat to introduce yourself now, and as you see fit, reflect on what you're hearing throughout the presentation. You can also contribute to the discussion by sharing your thoughts on Twitter using the hashtag #WeCanForKids. If you have questions for our panelists, please don't hesitate to use the Q&A box located in your control panel. This is separate from the chat box. This session is being recorded and will be made available on the Inspiring Healthy Futures website next week. We do have automated closed captioning available. You can turn the captions on or off using the CC button at the bottom of your control panel. We will also have French translation captions available on the recording. So on that note, let's get started. First, I'd like to welcome Lisa Wolf of UNICEF Canada to review the vision that participants in Inspiring Healthy Futures collectively described, the actions they determined will take us there, the process by which this was achieved, and the next steps that the sponsoring partners have planned. Lisa?
Thank you very much, Emily. And greetings to everyone. It's great to have you here. I'm joining from the traditional territories of the Wendat, Haudenosaunee, and Anishinaabe peoples on the land of the Williams Treaties. And with our treaty commitments, trust was placed in Canada to create the conditions for a good life for future generations. And newer treaties like the Convention on the Rights of the Child embed promises and duties to children. Now the pandemic is disrupting the development and well-being of the current generation of children and youth, and it may cast a long shadow over their futures. Certainly the family, community, social, and economic fabric they count on has been frayed, but the pandemic has also deepened pre-existing shortcomings and inequities in access to services, income, and even the basics of life. Just before the onset of the pandemic, Canada ranked 30th of 38 rich countries in child health and broader well-being. It's not for lack of money we find ourselves at the bottom of the UNICEF rankings, it's a lack of priority. The state of Canada's children, youth, and families galvanized us to come together around a goal to do everything we can to measurably improve their health and well-being, putting an end to these kind of statistics, because we can. That meant bringing a large and diverse group together to identify urgent actions to emerge resilient and inclusive from the pandemic, and sustainable actions to create the conditions for great childhoods for future generations. We formed a partnership around this optimistic goal, sponsored by the CIHR Institute of Human Development, Child and Youth Health, Children's Healthcare Canada, UNICEF Canada, and the Pediatric Chairs of Canada. And I'm honored to share with you the purpose that united us, the process by which we came together, and the priorities that connect us in a mission to ensure that the end of the pandemic is the start of something better for children, youth, and families. We enlisted the potential group to co-design an engagement process and launched Inspiring Healthy Futures, We Can for Kids. Between September and March, as Emily noted, we engaged more than 1,500 diverse youth and parents, advocates, policymakers, service leaders and providers, youth serving agencies, researchers, business leaders, and we had conversations about what is most important and urgent for the well-being of children, youth, and families. And we co-created a vision to unite around and an action plan to align for maximum impact. And for those of you in the room who were part of this journey, thank you very much, and please hang in. We have lots to do together. For those just joining, welcome. We are pivoting to a really exciting part of our process now, and glad that you are on the journey with us. The participants in our process envisioned a country where everyone has access to the basics of life, where a clean, green environment is accessible and sustainable, where equity and belonging can be taken for granted, and where kids can just be kids, safe and free to play, where children and youth are heard and hopeful. 5 interlinked action priorities emerged to achieve this vision, a song sheet for a big and growing chorus of voices. And I'm going to share just a few of the actions within these priorities. You can find the full agenda at inspiringhealthyfutures.ca. At the center, what we heard is a deep desire for mobilized communities around children, youth, and families. And over the past months, a lot of us joined tables and conversations we don't usually find ourselves at. We crossed sectors and communities and locations and ages, and we want to keep building these relationships. Right now, we want to row together for COVID recovery, for mental health support for youth and parents, mental health first aid training for teachers and service providers, and keeping schools and youth programs and spaces open and inclusive and functioning to the fullest possible extent. But we want to find a way to create a nimble network that could keep all of us connected, able to locate each other and inspire each other and help each other. The participants also want to accelerate research and knowledge into action, but they want research that brings diverse youth, child, and family voices in, and strategies to guide research with life cycle and cross-disciplinary and equity lenses. There was a really strong interest in more connected research partnerships to better understand and help mitigate the myriad and interconnected impacts that COVID's having on children and families, and to bring a focus on youth with complex needs, at-risk, and transitional youth. Oops. There was a lot of interest in different ways to make space for young people in decision-making. And participants agreed that incorporating child impact assessments would help decision makers center their considerations on children and elevate the priority given to children in decisions. We see an opportunity to include robust child, youth, and family well-being outcomes in emerging well-being budgets that governments across Canada are developing. And we heard support for a federal accountability office for young people guided by their voices, and for lowering the voting age across the country so young people can shape the policies that will shape their futures as Canada emerges from the pandemic. Participants placed a high importance on making family-friendly policies more inclusive and flexible, including a Canada Child Benefit that actually ensures no child falls below the poverty line, childcare and prenatal income support and parental leave, and at the other end of childhood, a Canada Youth Guarantee so that every youth can reconnect with school and recover learning. Every youth is assured a place in post-secondary education, training, or employment. And every youth in care has access to transitional supports. They can reach for a good future. Participants said that we could do things differently to integrate and wrap services around children of all ages and their families. There was so much discussion and energy around the potential of schools and communities to be places where service providers can come closer together to provide childcare, learning and development support, social care, access to diagnoses and therapy, and where every student has access to a free, healthy meal every school day. Parents emphasized the need for family resource programs that support healthy relationships, service, navigation, and financial planning. And there was recognition that everyone has a role to play to foster free play and leisure and mobility during the childhood years, to depressurize young people's environments and make them safe and inclusive, and just let kids be kids. As a matter of urgency, participants insisted that every First Nations, Métis, and Inuit child, youth, and family must have a source of clean water. And we called for the implementation of Jordan's Principle and the Spirit Bear Plan. We heard that children and families need easier access to timely, appropriate mental health and development services, particularly for children with disabilities and medical complexities, delivered close to home, and fully funded through the health system, and that an integrated health and social service record could facilitate this. And we want children and youth to have access to approved, safe, and effective medications through a national pharmacare strategy. Our process to date asked, what are we all in for? And now the question is, what will we do? Now is the time to turn our attention to activating on our priorities and creating the future that our children, youth, and families deserve. As one colleague said, this moment of crisis offers an unmissable opportunity for action. Now, some of our priorities rely on governments and some have momentum, but we need to keep reminding Canadians why. Some of these priorities fall to us, to civil society, and we'll hear about a great new initiative later on. One thing that everyone can do is participate in a new public awareness campaign that we're launching today, using resources available at inspiringhealthyfutures.ca. And we'll be amplifying a dialogue that we hope you'll join about the urgent things we can do now as the pandemic evolves and season the debates that are unfolding about the future of Canada. So we invite you to situate yourself, your work, your hopes in this dialogue and adopt the priorities that you love. And we'll continue to measure the changes in children's lives. Thank you so much for all you do. I'm just grateful to be part of this community of care. Back to you, Emily.
Thank you, Lisa. It is now my pleasure to introduce and welcome Catherine Clark to lead a dialogue about how we can activate and secure the conditions that children, youth, and families deserve in one of our world's wealthiest countries. Named one of the Ottawa's 40 under 40 by the Ottawa Board of Trade, Catherine Clark is a nationally respected broadcaster, writer, MC, and the co-founder of the podcast, The Honest Talk. She is the president of Catherine Clark Communications, a consultancy which provides strategic communications advice and support. Catherine will be joined today by Vivek Gill, who works at BC Children's Hospital Research Institute as a student researcher and a health sciences student at Western University. Vivek is a member of the Youth Advisory Council of CIHR Institute of Human Development, Child and Youth Health, and served on the Executive Leadership Committee for the Inspiring Healthy Futures Collaborative. Brenda Lenehan is a mom to a young son with complex disabilities who has inspired her involvement in advocacy, research, and her home-based business selling adaptive outdoor recreational equipment. As a parent advocate for a grassroots group she founded in 2017, BC Parents of Complex Kids, she advocates for access to equitable support for kids with complex disabilities and medical complexity. Brenda works with ChildBright as a parent partner in hope that one day the research can inform needed policy changes both provincially and federally. Brenda has an optimistic heart and a hopeful vision of an equitable future for her son and all people with disabilities in Canada. And finally, Dr. Christine Chambers, the Scientific Director of the Canadian Institutes of Health Research, Institute of Human Development, Child and Youth Health. Christine is a leader in children's health research and care. She is passionate about patient engagement and research impact. Trained as a clinical psychologist, she is a Canada Research Chair in Children's Pain and a Killam Professor of Psychology and Neuroscience and Pediatrics at Dalhousie University. She runs a research lab based at the IWK Health Centre and is also the Scientific Director of Solutions for Kids in Pain, a national knowledge mobilization network. Catherine, over to you.
Well, Emily, thank you so much. And hello to all of you, wherever you may be joining us across Canada. Bonjour tout le monde. Quel plaisir d'avoir la chance d'être parmi vous tous et toutes aujourd'hui. It's my absolute delight to be a part of this critical conversation as we look to build a path forward that takes into account the holistic needs of Canada's children and youth and families. As Emily noted, my name is Catherine Clark. While I am a communications professional, I am, of course, also a mom. And that is the lens that I bring to our conversation today. And the issues that we're discussing really do have particular relevance to me, as they do for hundreds of thousands of parents and educators and health professionals and children and youth, you name it, right across this country. And I really have to tell all of you that I am so impressed looking at the chat here at this launch, seeing the excitement and the engagement that you're all expressing at being a part of this event today. I want to thank you for that, for your commitment to these issues, for taking the time to be here with us. We are all spending 99% of our lives sitting in front of a screen these days. And it is at least beautiful where I am, hopefully quite lovely where you are too. So the commitment that you're showing by being a part of this conversation is really, we're really grateful for it. Now, you've already heard our guests introduced. Emily did that just a couple of seconds ago. Again, we have Vivek Gill, Brenda Lenehan, and Dr. Christine Chambers, all here to share their unique perspectives today. But I really want to emphasize that we very much look forward to hearing from you as well. I hope you'll send in your questions. It's pretty simple to do that just through the Q&A section. So submit your questions as soon as they come to you. I'll try to get to those as part of our conversation quite shortly, because we do want this to be as interactive as possible. And you're certainly going to have questions that are relevant to your area of practice, your area of expertise or interest, and we do really want to have those as part of the discussion we're having today. So take the opportunity to join the conversation, and let's get that conversation started right now. Vivek, since this project is all about youth, I'm going to start with you. I'm going to put you on the hot seat first, because I really do understand that youth have played a big role in helping to shape this vision. Can you talk to us, Vivek, about that youth involvement?
Definitely, yeah, great question. Really, youth, I think, were the core of the development of this framework from the beginning. Our Institute of Human Development, Child and Youth Health Youth Advisory Council were consulted from the very start, and youth from all over the country were invited to numerous strategy hives and discussions aimed at hearing their voices and really trying to understand what unique struggles that they were facing at this particular time. And I really think that leadership in terms of this framework has worked really hard not to tokenize the youth voice, and it's really made sure that we are involved in meaningful ways and has listened to us, and we can see that reflected in the goals and the framework that we have today. So.
Well, that's great, Vivek. And I just want to emphasize, we are really glad that you're able to be a part of this conversation as well. And Brenda, you too, because you're bringing the perspective, of course, of parents. And we know that parents and families in Canada were struggling prior to COVID. Certainly, they're really struggling now. Can you give us your perspective on what parents have been facing during the pandemic? But also, Brenda, because we're future-oriented, we're hope-oriented, can you help paint a picture for us of what a healthy future would look like to you?
Sure, thanks, Catherine. And first, I just wanted to acknowledge I'm on the territory of the unceded territory of the Comox people out here on present-day Vancouver Island. And I also want to reiterate what Vivek just said about feeling heard. That certainly was the case through all the strategy hives, and it reflected in this framework. It's fabulous. So I come from the demographic of parents that have kids with medical complexity, and so that's where my experience is framed. We know that this there's a lot of challenges we face previous to the pandemic, which have really only been amplified and elevated. First and foremost, it's framed around the really heavy weight of deep concern for our children's lives. Every time we have to make a decision about whether we're going to go to our job or not, whether we're going to send our kids to school or not, starting last March. Whether we're going to have a therapist come into our home or not. Those real heavy weights have been quite profound for a long time now, for over a year. Constantly weighing risks is just enormously taxing. And I know this is the experience of many parents, but when you consider kids who are so fragile, and that was their experience previous to the pandemic, it just amplified. And with very little support to navigate and very, very few options. So really having to figure out how we're going to do this on our own and make these decisions. There were some great innovations that came out of this time period. Virtual service delivery has really helped bring some equity and less stress for a lot of families. There's also been some financial income benefits that have been, well, the ones that were aimed at all Canadians, but also currently one that's aimed at caregivers. Not everybody qualifies, but it's getting closer to looking like a support that would be profound for our families. So and it's definitely helped some families immensely, but not everybody's feeling that support. So in terms of looking to the future, certainly the equitable access to support. I mean, starting with those foundational pieces, mobility equipment, therapy, respite, to have real fulsome support so we can consider an equitable future for our kids and our families. It really always comes back to family-centered, needs-based, and through this document, I see a lot of rights-based foundational language. It's so important. It's across demographics, and it's really impacts our specific demographic quite profoundly. So certainly seeing a future that's a fully inclusive communities and a fully inclusive Canada is the vision that we hope for out of this. Hopefully there's some good that comes from the challenges we faced. Thank you so much.
Well, thank you, Brenda, because it takes a lot of energy. I'm sure it's exhausting for you day in and day out to be advocating for your child, to be advocating for your family. And I want to thank you for the work that you're doing and for standing up to be a part of this process to try and make things better for all families and for all kids, especially during a pandemic. Christine, this launch today, it's really the culmination of a huge amount of effort, and it's effort that's been on the part of so many people. I was saying off the top that I was really impressed by all of the very positive hellos that were coming in from across the country, from people who are in charge of organizations, from people who are working within academic institutions, health institutions. There's a real sense of purpose here. Can you talk to us about how what's happening today builds on prior work in this space?
Yeah, I think, Catherine, what you're seeing in the chat is what we often see and are grateful to see in the child and family ecosystem, which is just such a deep sense of commitment and ownership and also now with this pandemic a sense of urgency. So when I think about how this work builds on prior work, I mean the vision that we're putting forward in this framework, I mean it's more than any one organization could ever deliver. This is a framework that requires all hands on deck in a collaborative way. And I think really one of the things that has stood out for me from all of this work, and it's certainly come through in Vivek and Brenda's comments, which is just the very deep and broad engagement and commitment to this work. So even when you think about the leadership, the sponsoring partners of this initiative from 4 different organizations, three different leaders coming together and setting our own agendas aside and really thinking about how can we engage in a conversation that will lead us towards actions and very authentically engage and listen to all of these different voices. I'm a researcher by training, and researchers sometimes, are very focused on particular issues, aren't necessarily as engaged in some of these broader conversations. And just to see how many researchers showed up, because everyone realized that we all have a piece of this puzzle. We all have something to offer and to contribute to making and inspiring a healthier future for our children.
Yeah, and those are great comments, aren't they? Because you're right. Part of getting to from point A to point B is getting people to set aside individual agendas, to focus on one collective agenda, and to push forward with that. So it's pretty admirable that this is the stage that all of you are at right now. Vivek, I'm going to ask you a big question, but this is really a launch that has big plans. So bear with me. I just wonder if you can tell us what you think Canadian youth are hoping for in the future. I mean, that is a big That is a big question, but what do you think?
Definitely a big question. I can't presume to speak on behalf of all Canadian youth, but I really think that many of us are hoping for a more equitable, sustainable, and just future. And I really think that something that we're envisioning for Canada is a Canadian society that truly lives up to the ideals of diversity and inclusion that we've prided ourselves on, but have never really been able to achieve. And I really think that this framework goes and takes huge leaps towards that vision that youth are looking for. It's reflected in a quote that I saw in the framework, which is that this generation is impatient for change. And I do agree with that. I think a lot of youth see this time as the opportunity, as an opportunity better than ever to build back from our pandemic and create a more equitable, sustainable, and just future.
Well, and the other element, Vivek, is that so much has happened during this pandemic too that's focused our attention and the attention of young people on what isn't going right and what could be done better. And you're right, there is an impatience to fix that and a sense that this is an opportunity, isn't it? Like it's a very challenging situation, but it's an opportunity for us to think differently and build differently. So I want to encourage all of our guests today, everyone in the audience, to know that we really do welcome your questions. I have a bunch of questions for our guests, but I'm pretty sure that you do as well. So by all means, please put your questions into the Q&A and we will get to them as quickly as we can. Brenda, I'd like to go to you again, building on what Vivek has just said and coming from a parent's perspective. Can you give us a sense also of what you think needs to happen next?
Yeah, that's also a big question, but I feel like what has happened is tomorrow starts today, that it's started. What needs to happen next was started with this process, and I really the interconnectedness that it brought together. It was brief, but it was fulsome. But to have families, researchers, organizations, to have everybody together, that can't stop. That needs to just grow. And that was really profound. And then to feel heard, all those organizations, to really, a lot of similar messages came out through it. And I think just to keep moving in that direction, really expand across, see what we can focus on, the problems we've had, but we could really, more importantly, focus on the innovations, focus on what is going right across the country and expand on it and replicate it and grow it. And yeah, I mean, next, focusing on the really important, the access to water, that's huge, foundational, and the rights, those are really the next, but continuing to grow the collaboration and the interconnectedness of us all is important for sure.
Are you feeling confident that we can do that, Brenda?
I do feel confident through this initiative. I really do. Yeah, I feel, in BC, there's some really incredible things happening. There's a lot of family and parent engagement in some policy work, in some design of some new facilities. There's a lot of incredible things happening, a lot of synergies, and I think we're on the cusp of it. I feel confident that we're going there. Yeah, I do.
So Christine, what fuels you with optimism today? Because Brenda's just expressed some optimism. What are you feeling, both about the collaboration that's resulted in today's launch, but also about the action priorities that are outlined in it?
Yeah, well, I think, what really kind of fills me with optimism is the opportunity to make a difference. So sometimes, when we're dealing with big issues, they can feel overwhelming. And really, why we all came together was to figure out, yes, how can this be a call to action for others, but also what can each of us do in our own roles? So certainly in my role at the Canadian Institutes of Health Research, we are committing to a new funding opportunity in the area of the impact of the COVID-19 pandemic on children, youth, and families. And more news will be coming out about that from CIHR very soon. But that's just an example of, one thing that I can control, that I can help to lead. But we, all of us in this collaboration, Emily with her, hats on at Children's Healthcare Canada and pediatric chairs, Lisa at UNICEF, we're all in an opportunity, and we've been delighted to see how many organizations, even in an early stage, have stepped up and said, listen, I can help with this piece, and I can help with this piece. And it's that kind of collaborative teamwork and a willingness to figure out what are the pieces that each of us can touch and influence and improve, and how can we keep this all coordinated and collective. And so for me, the vision is inspiring and provides a sense of optimism, but also the commitment to action and influence as well.
So we're going to get to some audience questions now. And Vivek, I'm going to ask this first one of you. It comes from Jennifer Gillivan. And the evidence is overwhelming. This is Jennifer's question, and need is great. So how do we get the mainstream public to become aware of how things are and how much we all have to push for real change? Do you have any thoughts on that, Vivek?
Another tough question, but I really think it starts with initiatives like this one, where we have a solid vision for what we want to demand, and we are giving tools to people to take it into their own hands and help us push for the change that we've all expressed through this framework. And so part of this framework is a media campaign, really, that's launching today, I believe, to create more awareness. And so I really think it starts here.
Can you talk to me and to us about the communication aspect with youth too? Because that's a lot of what this is too, isn't it? It's not just mobilizing the adults in the room. It's mobilizing kids and youth to ensure that the adults in the room keep hearing about this. How do we do that effectively?
Yeah, I think it involves meeting us where we are, which is not always easy, but it requires, I guess, creative ways of reaching out to youth, specifically in terms of contacting them on social media, reaching out to places where they are already, and making space there for conversations that we want to have.
Yep, that's good advice, Vivek. Christine, a question for you as a researcher. How can we ensure, and this comes from Allison Gerlach, how can we ensure that we do not continue to do research in organization and or geographical silos? We need to be able to have stronger national interconnectivity so that we're all moving in the same direction.
Yeah, it's a great question and a great comment. And, anyone who works with me knows that I'm often talking about everyone needing to stay in their lane, but lanes need to be moving in the same direction. And we often don't see that. I think collaboration and coordination all comes from building relationships. And, I think that's been a key part of what we've done through the process of this initiative this year, and the incredible work that the Potential Group, and the conversations that they helped to create. We're creating linkages amongst groups, individuals, organizations who had never met before, who never had the opportunity to intersect. And so, that creating of connections and identifying potential areas for shared alignment is something that I've always been committed to. And we're definitely, trying to find ways of how can we, even through this initiative, it's been amazing to see researchers connect with different organizations and realizing that this could be a really incredible collaboration that would augment the impact of their research and ground it more within, the needs of the communities the research is intended to benefit. So I think, it's all about relationships. And I think what we've been able to do through this initiative is really provide opportunities for connection and relationship building that haven't been there and will continue to grow.
Brenda, this next question I'm going to throw to you. It's from Ann Watkins, and she asks, I think a lot of people in this country and outside of it would be surprised to know the state of our children and youth. Why have we come to this point? What are your thoughts on that, Brenda?
I honestly think it is partly about the awareness piece. I think that on a lot of levels, Canadians believe that families like mine, children like mine, are well supported in this country. Disability poverty starts really, really young in our country. It's a problem in adulthood, and it starts at birth in a lot of cases. And I think that Canadians don't. I think they don't see that. They don't see us. They don't see our families. And I think that an awareness is really important, because I think Canadians would be really surprised and really appalled if they realized. And I think that that's part of what needs to happen next as well.
So Vivek, this question's from Julia Hannigsberg, and she asked, do you think that the circumstances of the pandemic have made the public and government more ready to hear the messages we're launching today? What are your thoughts on that?
I definitely do. I think the amount of change that we've seen in our everyday lives has pushed people to realize that we are in need of bigger and better solutions that previously seemed maybe I guess unreachable or a bit too ambitious. But really, I think if there's anything this pandemic has showed us, it's that we need large change, and we need to start doing it now, because now is really the time to be making the change.
Christine, I'm going to throw this next question to you. It's from Dr. Mahendra Sheth, and it's, do we have equity-focused, disaggregated data for children in Canada for health indicators? Are you able to take a stab at that one?
Yeah, certainly. I mean, one of the interesting conversations that has arisen over the last year is, what data do we have related to children, you know, at the local level, at provincial levels and federal levels? And there clearly are lots of gaps and lots of, you know, spaces where there needs to be more coordination. And so I think that would be one example of a spin-off conversation that we have already been initiating, both within government and with stakeholders outside of government, around what do we need to do to make sure that we have the data we need to be able to build on from this pandemic. I also wanted to kind of build on Vivek's, you know, excellent answer to Julia's question around, you know, what do we think there's a moment in time now that we can seize? And I completely agree. I mean, this, you know, if ever there has been something that will have shaken us to our core, it is this pandemic. And to steal a phrase from Lisa Wolf, my colleague at UNICEF, who said, we'll be emerging from this health crisis with a children's crisis if we, you know, do not realize the significance of the issue that we're facing. A generation of children and families who will be carrying this forward in many different ways, you know, in terms of their emotions, their learning, their cognitive development. So there's just an incredible urgent need. And I think everybody can see it and feel it, but the continued need to raise awareness. And the statistic from UNICEF blows people away. Whenever I present that report card result, people cannot believe it, because I think we do operate with an assumption that we are doing better than we are. And the fact that that was collected before the pandemic, I mean, that is a baseline that we need to work from and improve from. And as Vivek said, a chance to innovate, big change, think really differently. I mean, schools and health have never been as connected as they should have been. Well, this year we've realized they need to be, they go hand in hand. The relationship with childcare and all of these pieces. So there is an opportunity here now to think big and to innovate and think differently about things that I think we've just assumed needed to be a certain way.
Yeah, I think that's really part of the problem, isn't it, Christine? That we assume that because we're Canadians, because we live in Canada, that we are delivering the very best of what needs to be delivered. And we're not necessarily seeing the gaps. You're all seeing the gaps. That's why you've worked together for this initiative. But you're right about people seeing those UNICEF numbers and thinking, wow, And imagine what's going to happen a year from now when the real statistics about what's happened during the pandemic truly start to come out, and we're going to have an even bigger wow moment. So that's why today really is so important. And on that front, this next question, Brenda, I'm going to ask it of you. It's from Rachel Martins, and Rachel says, how do we begin the complicated process of emotional investment or buy-in for some of these initiatives at a provincial level? How do we move the thought process obligation to moral imperative?
That's a good question. I think, again, it's back to awareness in a lot of ways, raising the profile of the issues that families face. And yeah, I think it's heavy work. I think in some ways, sometimes the rights-based approach, people that really shows people where we're dropping the ball, where we're failing our kids and families. But sometimes I think we also need to raise the profile of the economic arguments. We need to show, there's so many people tied up as caregivers of their kids because there isn't fulsome inclusive supports for their kids, that we have incredibly talented researchers, doctors, people that drive economic value in our country, really tied up in work that is hugely valuable for their family, caring for their kids. But sometimes we need to make that economic argument for inclusive childcare, for all these pieces to be fulsome and supportive, because the impacts down the road, they will truly benefit all Canadians. It's not about our demographics specifically in silos. It's really like an inclusive future will truly impact all Canadians. And I think we need to share that message and share it loudly. And yeah.
Yeah, I agree, Brenda. It's interesting how moral imperatives are often tied to economic outcomes. If you can prove the economic outcome in a positive way, well, that sure reinforces your moral imperative. Okay, Vivek, I'm going to ask this next question to you. It's from Deborah Pepler, who is very excited about the ground up work done by Inspiring Healthy Futures. And she says, I think that you have identified a core problem that children are not a priority in Canada. There is no federal door to knock on to ensure that children and youth needs are being met and their rights upheld. Some provinces have a door to knock on, others don't. How do we get governments on board to care and act for the well-being of children and youth?
I completely agree. And a lot of the discussion we had in our meetings to create this framework centered around the fact that there is no federal office that is accountable to children and family and youth. And so part of the framework is to create an accountability office. And I think it has to be, those offices have to not be siloed in their work as they have been, quite frankly, in some provincial offices that have existed in the past and in the present. They need to be a core part of government decisions, and they need to not be subject to the whims of changing governments every so often. So I completely agree.
Well, and Christine, building on what Vivek has just said, Nicole Fiorentino says, humbled by this initiative. Long term, though, what are the targeted policy changes that will ensure this initiative's aims are adopted and sustained? Who are the key players that can make this happen?
Yeah, so it's a great question. And obviously, we came together to create this framework. And then now we're each looking to how can we develop and support pieces of this. The policy piece is absolutely critical. And, we at CIHR are part of the federal government. So we're working within government to see, what can we influence? What can we support? And colleagues outside of government, such as Children's Healthcare Canada and other organizations, UNICEF, working to try to influence policy, from that angle. So I think the key for this initiative is lining up all the right pieces, making sure that the knowledge that we have, that the evidence that's funded and created through research is used to inform policy, bridging those gaps in different ways. But yeah, we need a coordinated approach, which is what we're trying to take moving forward from this. Lots of different groups, lots of different people, every voice matters, and the value of youth and parent voices and pushing for change, and for, you know, letting different policymakers and decision makers know that this needs to be a priority is so critical.
Christine, can I follow that up too with a more specific question from one of our audience members too? It's from Catherine Manning, and she's asking, what are some key features that will help identify children and youth at risk of serious mental health issues post-pandemic? And how can we reach rural communities? I mean, this is a question that pretty much every family is dealing with on one level or another, a conversation that is coming up around the dining room table at night, right across this country. Can you just give us some thoughts on that? Because I think it's an issue that's a concern for a huge range of people.
Yeah, absolutely. And it's a great example of where, you know, we have, for example, CIHR funded researchers who are studying exactly this thing. And the new funding that will be coming will also be targeted in particular at increasing our knowledge around at-risk youth, or particularly, you know, groups of children and families who may have been disproportionately impacted by the pandemic. But then it's all about how do we move that knowledge and research into practice and policy. And through some of the connections, through some of the mechanisms we're building into this funding opportunity around the relationships, it's one of the things I've learned is it's so important to have the right information available at the right time to the right people. And I think what this collaboration has done is brought together some of those groups so that we can, you know, have that type of synergy happen, so that we can identify those at risk, that practices and policies are developed that are based on evidence that will be supportive, and that there's opportunity for innovation of our healthcare system and education system and all the other components that we need to have working together for children and families.
So I'm gonna go to only one last question because our time is coming to an end. Just for the Q&A session, of course. But I'm going to ask this of you, Brenda, as a supporting organization, and this question comes from Jen Turner. What can we do to support the campaign and push this forward? I mean, what's your sense, Brenda, an overall perspective of what we can all be doing to get behind this?
Oh, that's a tough question. I guess focusing on, you know, maybe revisiting this document once in a while to stay focused and in our own work and what we're doing, try to stay connected, collaborative, and aligned. I think alignment is going to be important if we're all working on these foundational moral imperatives, as Rachel said. Then I think that it'll happen. I mean, there's some plans to sort of help house that connectedness and tap into it and reach into it. And I think that we can create. I think we can help create the landscape that we want to see if we work at it.
Well, look, I just really wanted to thank each and every one of you. Thank you for your time, Vivek, Brenda, and Christine, for being a part of this conversation today. It's been a real pleasure. We're not done yet. We have a few more words that are coming up. I think at this point, I'm going to just turn things back to Emily to lead us through the rest of our conversation. But thank you very much, and thank you to our audience for your excellent questions as well.
Thank you, Catherine. So as you can probably see, we have nearly 200 folks in the line, and there's no doubt, especially based on your questions, that you're deeply engaged in activities related to or in direct alignment with the priorities that we have identified in this action plan. We'd love to learn more about your work. We'd love to consider how we can connect the dots between your work and the efforts of others. Here's a great example of a new initiative that's launching today and speaks specifically to a priority on our acceleration agenda. I'd like to invite two friends to the stage. Mary Ellen Rayner is the Sandbox Project's Communications and Partnerships Lead and Manager of the Sandbox Impact Program. Mary Ellen works with a broad network of child and youth-focused partners to build connections and coordinate projects across sectors. Yumianga Yogalingam is the Research and Knowledge Translation Lead at Sandbox Project and the Co-Executive Director of the Young Canadians Roundtable on Health, the youth-run National Advisory Committee that works in partnership with Sandbox Project to help make decisions in the child and youth health sector through collaboration with industry, government, research, health leaders, and families. Over to you, Mary Ellen and Umianga.
Thank you so much, Emily, and thank you for having us here today. We're really excited to continue being a part of this important work and these important conversations. I just wanted to start off by talking about who we are and what we do. So for those of you who are not familiar with us, the Sandbox Project, we are a national charity working to improve the health and well-being of Canadian children and youth. And we do this mostly through providing collaborative capacity across different stakeholders in the sector. We also provide knowledge mobilization support, as well as resource sharing to drive innovation within the sector and to try and lessen the sector from working in silos, which has, I think, been a huge theme of this webinar. And we mainly do our work through our staple program called the Sandbox Impact Program. So this program builds on the success of the Sandbox Project's innovative working model, but on a more smaller scale and on a more project by project basis. So with this program, we support initiatives that leverage multiple partners that address health and well-being challenges that Canadian youth and children are facing. And then in addition to the Sandbox Impact Program, like Emily mentioned in our introduction, we also have the Young Canadians Roundtable on Health. So we are a national youth-run, youth-led advisory committee, and we have over 30 youth across Canada that actively participate in decision-making around child and youth health through collaboration with industry, governments, researchers, families, and so on. So that's a little bit about us. In terms of our involvement with the Inspiring Healthy Futures Initiative, we've been involved in a number of ways. So we've been active participants in the strategy hives. We've amplified messaging from the initiative to our networks. And we've also conducted stakeholder interviews as part of the core engagement team. And then with our Youth Advisory Committee, the YCRH, we've also helped organize and host 2 youth forums to kind of get the youth perspective and to understand the biggest health and well-being issues that youth and their families face and what they want to see for the future of children, youth, and families in Canada. So as we mentioned, the Sandbox Project and the YCRH is really excited to continue to have a role in the next steps of the Inspiring Healthy Futures Initiative. And I'm going to turn it over to Mary Ellen to tell us a little bit more about that.
Thanks, Umi. So we're very excited to be here today as part of this mobilization to create a national child, youth, and family hub or network of networks that connects a community of care across research, policy, advocacy, and systems and services around children, youth, and their families. So we'll be lending our Sandbox Impact Program and also our experience as a convener and collaborator in this space towards setting up some next conversations around what this network of networks could look like for all of us. This work is picking up from some key considerations that participants in the strategy hives have brought forward. One big question being, how can people across the child and youth sectors gather in an accessible and equitable way? How can we create something that's inclusive and also intergenerational? And while technology might play a role in what develops, really the core need that was identified was the need for connectedness and the need for community. So our next steps right now is to find out in greater detail what features of this hub would be the most helpful to you and how would you use this? So just to give a couple of examples quickly, some gaps that have already been identified. One thing we've heard so far is that this hub could potentially help to navigate who is doing what work in different child and youth spaces across the country. Or to give a second example, perhaps there are opportunities to host virtual conversations that bring together many multi-sectoral perspectives around one specific child and youth topic. So those are some of the ideas that we're beginning to explore. Just before I pass it back to Emily, I just want to say that we're very much looking forward to working on this with you. And we'll be reaching out over the next few weeks. But in the meantime, if you would like to share any ideas that you have with us, please don't hesitate to get in touch with myself or Umianga. And we look forward to connecting with you and getting your perspectives. Thank you very much.
Thanks, Mary Ellen. So on behalf of my peers at UNICEF Canada, CIHR Institute of Human Development, Child and Youth Health, and the Pediatric Chairs of Canada, I would like to thank our guests who joined us today on this virtual stage. I also want to thank each one of you on the line. Together, we have a unique opportunity. Together, we can measurably improve the health and well-being of children, youth, and families in Canada. I hope that the priorities you heard today resonated with you. I want you to check out our new website, inspiringhealthyfutures.ca, and download our report. You can also sign up for our mailing list to stay up to date and stay engaged on our forthcoming activities. In the true spirit of this initiative, I want to hand over the mic to one of our youth to say our final closing goodbyes. Vivek?
Thank you, Emily. I feel very fortunate to be able to close today's session, and I wanted to take a moment to really reflect on what this vision of inspiring healthy futures means for Canadian youth. I think if there's one message we can take away from this framework and action plan, it's that the youth of Canada have good reason to have renewed hope for our futures. This framework is a testament to the fact that leaders across every sector are meaningfully invested in ensuring that every child and family across Canada can reach their fullest potential, regardless of their circumstances. Today is just the first step in a long journey in which decision makers can expect to be pushed to do better for families and youth, and can be held accountable to the vision that Canadians from coast to coast have voiced through this Inspiring Healthy Futures framework.